to making sure that we're keeping you up to date with accurate information. And I know that there's been a lot of conflicting information out there that's going around. For instance, disinfectant should never be injected into the human body. And so I wanted to convene this call with a leading physician from the front lines of our community so we could all have access to the best possible information about smart steps that we can take to help mitigate the spread of coronavirus. So I would recommend also that you have a pen and paper available to take notes because you might find some good information and some good resources during this call. I'd first like to take a moment to discuss the work that we're doing in Congress down in Washington, D.C. to combat the coronavirus across the country. Last Wednesday, I returned to Washington to help pass the fourth coronavirus relief package. This was a bipartisan act called the Paycheck Protection Program and Healthcare Enhancement Act. And this legislation included a number of priorities that I had been advocating for on behalf of our community, including PPP funding or Paycheck Protection Program funding that would be set aside for small and community banks to ensure that PPP loans were made to our smallest of small businesses. I also hosted a number of roundtables and town halls with our small businesses, and it was clear that the PPP system was failing to reach those smallest of small businesses in our community and across our country. And so this most recent legislation aims to make it easier for those businesses to access our PPP capital. The bill also includes robust funding for hospitals and healthcare workers who are on the front lines of mitigating the spread of this pandemic, expanded eligibility for EIDL loans, which are the emergency loans for agriculture producers like our mushroom and dairy farmers, and a requirement for comprehensive national testing strategies. To safely reopen our country and to return to some sense of normalcy, we absolutely need to swiftly implement a comprehensive national testing strategy. In order to execute that strategy, we need a team of dedicated civil servants who can carry out testing, contact tracing, and more. And that's why I'm leading a bipartisan coalition in calling for the creation of a national public health corps, which would help aid our frontline healthcare workers on the ground and across the country. As an AmeriCorps member and veteran myself, I know what it takes to serve this country, and I know how hard those on the front lines are working to mitigate the spread of this pandemic. We need to do everything in our power to support their efforts, and I urge the administration to move expediently forward in creating this vital national public health corps. Last week's legislation built upon the Coronavirus Aid, Relief, and Economic Security Act, which most people refer to as CARES. It was a historic bipartisan stimulus package that delivered urgently needed relief to those in our community and across the country who are being impacted by the coronavirus. Among other things, the Coronavirus or CARES Act provides a direct cash payment of up to $1,200 per taxpayer and $500 per child for many Americans. In addition, it has an additional $600 per week to each recipient of unemployment compensation for 4 months, and it extends unemployment compensation for those whose benefits were scheduled to expire. An estimated $4.9 billion was provided as well for Pennsylvania for additional resources to cope with the pandemic, including for the purchase of personal protection equipment or PPE, and including for the purchase of testing supplies. The CARES Act also had $200 billion for hospitals, health systems, and health research, and nearly $350 billion in forgivable loans or PPP loans for small businesses to be able to pay their employees and keep them on the payroll. In addition, the CARES Act provided $17 billion for debt relief for current and new small business borrowers, and $10 billion for immediate disaster grants for small businesses of up to $10,000. Also, there was more than $100 million for personal protective equipment for our nation's first responders. There was a temporary deferment of payments towards principal and interest on federally backed student loans and a stoppage on interest accrual for 6 months on those loans as well. The bill also waived the 10% penalty on early distributions from retirement accounts, allowing people who were diagnosed with COVID-19 or who may be economically harmed by the virus to be able to access their savings for immediate needs as well. The CARES Act also prohibits evictions for renters and foreclosures for homeowners with federally backed mortgages. and it ensures that COVID-19 testing is covered by all private insurance plans without cost sharing. We simply don't have time for partisan politics during a pandemic, and I'm continuing to work across the aisle and with this administration to do the right thing by Pennsylvanians and to honor my oath of office to protect our Commonwealth and our country. Now, I'd like to spend a couple minutes discussing a development that, while predictable, still very much saddens me. A continued uptick in scams. Predators are preying on people's fears during this pandemic and are disseminating misinformation across social media and digital platforms to try to scare and to try to con you. Here are some things to watch out for. There is currently no vaccine for this virus. Please ignore anything that suggests otherwise. There are no at-home test kits available for purchase. I have been inspired by so many of you who have stepped up and given back to our community during this trying time, but please don't let people take advantage of your goodwill. Be wary of any mass solicitations from any so-called charity, and please always do your research. The Social Security Administration offices are closed to the public due to the coronavirus concerns. However, they will not suspend or decrease Social Security benefit payments or supplemental security income payments due to the current COVID-19 pandemic. Scammers may try to solicit your personal information, trying to convince you it's necessary to receive your benefits. Please ignore these, and if you do have a question, please contact the Social Security Administration. To stay up to date on the latest scam tactics, sign up for consumer alerts about scams from the Federal Trade Commission online at, and here's where you might need your pen, www.consumer.ftc.gov. Again, to sign up for information about the latest scams, please go to www.consumer.ftc.gov. At the local, state, and federal level, we are taking action to rapidly flatten the curve. By staying at home, we are buying time for our first responders. This is a very difficult and trying time, and we are absolutely being called upon to be our best selves. This is about our community as a whole. It is as much about protecting our friends and neighbors as it is about protecting ourselves. On my social media, you can follow this in our #InThisTogether campaign, where we highlight stories of people around our community who are volunteering and helping one another. These stories serve as a constant reminder that so many around us are stepping up to the plate and doing any and everything they can to help our most vulnerable. It's one of the reasons I am most proud to call myself a Pennsylvanian. As a former entrepreneur and chief operating officer of a company in Chester County, I know how hard this is to be a small or mid-sized business owner and operator. If you are struggling, please do reach out to me and my team. By hearing from you, I'm able to advocate for policies that will directly impact Pennsylvania's small businesses. I have advocated for provisions in all of our stimulus packages to support and protect our small businesses, the backbone of our economy during this crisis and at all times. My office is here to help. You can email us, and here's where you might need your pen again, at pa06.smallbusiness@mail.house.gov, or you can visit my website at houlihan.house.gov. Houlihan is spelled HOULAHAN.house.gov. And we can help with anything from applying to unemployment for recently laid off workers or applying for emergency disaster loans for your small business. We cannot let this virus destroy our community's thriving businesses, and we'll do everything we can to make sure that doesn't happen. I'd like to note that while our offices are following CDC guidelines and are operating via telework, our phone lines are still open and our work still continues, be it around the coronavirus or around casework or around answering constituent concerns. We have set up a number of rapid response teams, and their emails are up on the screen now. If you have any questions about small businesses, unemployment, or your rebate check, please don't hesitate to reach out to us. In terms of our call today, rather than try to answer all of your questions myself, because I'm certainly not an expert on the topic of coronavirus, I've invited Dr. Benjamin Abella, attending physician and vice chair of the Department of Emergency Medicine at Penn Medicine, to take questions with me today. The structure of this town hall will be as follows. First, Dr. Abella will speak to the latest medical developments on the coronavirus, what we have seen in the US and in our community, and the best practices at this time to protect yourself. Following these remarks, we will take your questions. To ask a question at any point, please comment on this video below. We will do our best to answer as many questions as possible. Thank you very much for your time today. I am now pleased to hand it over to Dr. Abella for his comments.
Houlihan for inviting me to join today. I'm speaking to you live from the offices at the Emergency Department of the University of Pennsylvania, where I've been very involved in both COVID medical response as well as research related to COVID treatment. So I've been very involved in this. It's been a challenging time to be sure, but a time where I, like Chrissy, have been very inspired by colleagues in the emergency department and other healthcare workers really stepping up and coming together. It's been very inspirational, actually, and we've been making some progress. So a couple of comments first about where we stand today with regard to the virus and treatment, and then some important misconceptions to clear up. So first off, we're very much still seeing patients with COVID every day in Pennsylvania and in the United States. So it's important to know that while it appears that we are beginning to see a turn towards less patients per day, we're still seeing them. So we're not seeing a drop. I mention this because I think many of you have seen things in the media suggesting that we can open things up and that things are getting better. Maybe we're seeing just the very earliest signs of a slowdown, but we're still having more than 20,000 cases, new cases per day in the United States being reported. So in no way have cases started to massively fall. So that's an important general point. Another important general point to make is that we are still working hard to ensure that we have enough supplies, protective equipment known as PPE for healthcare workers. There's been a lot of work from multiple fronts on this, including both governmental but also private responses, which has been very important. And as a healthcare provider, I'm very grateful to many of you in the public for helping support us and understand that this is a time where we all need to work together to combat this massive public health problem. Now, I mentioned that we are still seeing cases every day. The other important status update is where we stand with treatments and the vaccines. So there are a number of vaccine trials underway right now, but I think it's important for everyone to hear that it is highly unlikely that we will have a vaccine that we know works within the next 3 months. I think it's going to be more of a 6 to 9 to 12 month time frame. I'm not a vaccine expert, but this is what my vaccine expert friends tell me. So if anyone hears news that a vaccine is just around the corner next month, next weeks, that is unlikely to be the case. Vaccine work is careful and there's a stepwise progression to how that work is done, and it just will not be completed in the next month or two. That leads me to, I think, the most important reminder for all of us. The lack of a vaccine on the horizon means we have to take action ourselves to protect ourselves and to combat this pandemic. And the best approaches to this have been and remain that to have social distancing, and I prefer to use the term physical distancing, because by all means, we should be social. We should be social on phone calls. We should be social on the internet. We're social creatures, and it's important for us to stay connected to friends, families, loved ones, but we should be physically distancing. And that means 6 feet apart from other individuals whenever possible, certainly when out in public. That means wearing cloth masks or paper masks when we're out in public. And this also means we should be washing our hands regularly. I strongly urge all of us to get in the habit of washing our hands multiple times per day as a reflex. And by washing, I mean plain old soap and water. If you have Purell or other alcohol-based hand sanitizers, that's great too. But plain old soap and water works great to destroy this virus. And through hand washing, physical distancing, minimizing going out, and wearing cloth masks, you can dramatically reduce the chance that you will contract this virus. Many people have, like myself, go out in public because we have to, because we work. I've fortunately not caught this virus yet. I'm very careful about washing hands and wearing masks, and I suspect that has contributed, at least in part, to why I remain virus free, and that's good for now. So I think those are the really important updates. Now, as far as some misconceptions, and then I'll stop and we can move to questions. You should certainly, first and foremost, not inject bleach, or other disinfectants into your body. It's almost embarrassing that I have to say this, but I think it's really important to put it out there. The companies like Lysol and the makers of other disinfectants have agreed and been very forceful in saying, do not inject or ingest these materials. Statements in the public sphere that have suggested that we can do so have actually led to a number of emergency department visits around the country for people with caustic bleach ingestion problems or fume problems. Bleach and other disinfectants are meant for external surface use, not for human bodies. That's an important thing lest anyone wasn't sure on that. Now, a couple of other misconceptions that are very important to clear up. Right now, we do not have any treatments for COVID. So anyone talking about miracle cures with zinc or with vitamin C or with ultraviolet light or sunshine, these are not cures for COVID-19. There are no known treatments, and it would be unfortunate if any of us had this idea that if we took lots of zinc, we could no longer have physical distancing, or if we go outside to get sunlight, that it will somehow protect us. We do not believe it will do so. So those are important things to know. Another important misconception is some of the medical treatments. So there's been a lot of confusion around a medicine called hydroxychloroquine, for example. Early on, national leaders in part talked about how this might be a wonder drug. On the other hand, the evidence is not clear. There are clinical trials underway around the country for hydroxychloroquine, including some at our hospital at Penn, and this is important work, but we do not know if this medicine works or doesn't work. There's laboratory evidence that this drug works to block the virus, but no clinical evidence. So any doctors who are rushing out to prescribe everyone hydroxychloroquine, this is against FDA guidance. FDA said that this medicine and other medications should really be under the guise of clinical trials, so we can learn what works, so we can protect the American public more adequately. So maybe I'll stop there, because I think your questions are the most important part. To summarize, we're still very much in this pandemic. It's not entirely clear when we're going to be in the free and clear. It's very important that you continue physical distancing and washing your hands. Those things work very, very well. And there's currently no medical treatments that you can take, unfortunately, to treat this virus. And then finally, I just want to end with the most important point I can make. It's important that we have clear understandings and clear messaging around this pandemic. And that's why I'm so grateful for Representative Houlihan and the work she's doing. Public health dictates clear and honest messaging. And so these sorts of communications are important. And I think part of the reason we've struggled is there's been panic, there's been inconsistent messaging. So as best we can, we have to stay calm, we have to be attentive, and not rush to panic, not rush to conspiracy theories, but rely on science and our political leaders who speak clearly and calmly about where we stand. So with that, I will stop.
Thank you, Doctor. I really appreciate your updates as always. And this is our very first Facebook live event. So we're still working with the technology, and I'm going to go over some of the questions, and hopefully this will work seamlessly, but we'll see how this goes. The first question that I have is from James. And James's question is that he still has not received his stimulus check, and why is it taking so long? And so I think that's probably a question more for me. And hi, James, and I'm sorry to hear that. I know that millions and millions of Americans still have not yet received their stimulus checks, and there are a couple things that you can do towards that end to kind of take a look and understand what's going on in your particular case. One is that you can go to irs.gov, and you can make sure that you have already registered, if you haven't already, your direct deposit information, because that's probably the fastest way that you can ensure that you're going to get your check is by having it via direct deposit. Another thing that you can do is ask us for help offline, and you can do that by emailing us at, and here's an email for you, it's pa06.taxesandrebates@mail.house.gov. And that's up on the screen right now. And so a member of our task force that's focused on this particular issue will be able to take a look at your specific case as well. There's also another website, which is a little bit longer, that you can take a look at, which is irs.gov/coronavirus/economic impact payments, with a hyphen between each one of those. So economic-impact-payments. I'm also looking, I know that there's a website, and I hope to get it to you by the end of this conversation, where you can, it's literally a Where's My Check website, and I just can't remember what the name of that is as well, so that you can make sure that the IRS doesn't have any questions for you that are unanswered that may be hindering your particular check from getting to you. But short of that, please also know that if you are not in line for auto deposit, that about 5 million checks a week are being printed and being mailed. And with that, if your check is being printed, it could take up to 20 weeks for that to happen. So that's even more motivation to seek help from our officer to make sure that you've got direct deposit keyed in. And so I hope that that's helpful, James. I'm sorry. I know how worrisome that is from some personal family experience as well. We've looked into that too. So thank you so much for your question. The next question is, and this is, I think, also for a combination of you and me, Doctor. It's a question from John. It says, why don't people see that this is past being a medical issue? Anybody who thinks that this is about saving lives hasn't gone hungry yet. And John, I very much appreciate you and the sentiment of your question and your statement, because you're right. Of course, this is beyond a medical issue. You know, it's an economic issue. Clearly, it's a supply chain issue that we've seen. It's a national security issue. And so I recognize that, and our conversation today, although focused on sort of the the medical response and also the governmental response, does not mean that there is not a lot of work also going on the supply chain issues, on the national security issues, on the food security issues, and on the economic impact issues. And in fact, I spend most of my day in conversations with our business leaders about the economic impacts, with our national security leaders. I serve on the Armed Services Committee as well as the Foreign Affairs Committee, kind of understanding the impacts and implications on a global scale as well. So there really is a lot going on that is part of this pandemic, but the root issue is certainly the medical aspect of it as well. So I'll turn it over to the doctor for any comments that he has about that as well, and maybe some of the ancillary effects of what's happening as we address the pandemic in a medical perspective.
Yeah, I think it's a really important point. This is beyond just a medical issue. I mean, this is unlike anything many of us have ever experienced. This has cuts across social, psychologic, certainly economic and financial. And I'm not an economist, I'm not a supply chain expert, but I very much agree with the question and the premise of the question, which is this beyond just medical. And I've read with dismay some of the major problems, for example, with the agricultural supply chain, that as we speak, millions of pounds of produce are rotting in fields as opposed to getting to hungry people who need that food. So we have demand, we have supply, but there's clearly problems there, and I'm sure Chrissy and others are going to be looking into that because that needs addressing. I'm a physician. I don't have perfect answers for many of those things, but what certainly I can speak to is that it is clear to epidemiologists, to physicians, to other healthcare workers that we need to get to opening as soon as we can. Our perspective as healthcare workers, though, of course, is always to speak with the medical voice, and that we want opening to be done when it's safe and when it won't provoke a second wave. And I think this is where it intersects a lot with, unfortunately, some of these economic and other activities. I think there's this perspective out there that those of us in the healthcare world are not paying attention to the suffering, the economic suffering, and this closing and keeping everything closed is purely medical. But if you think about it, it's more than that. We do recognize the hardship this creates. But if we open up too early, this virus is out there, and it's out there in a big way. It will blossom, and we will have a second wave that will really be stronger than the first wave in many ways. And then where that will that leave us? We'll have to shut down again, perhaps for longer. There'll be more deaths, more supply chain disruptions. So in many ways, this is one of these pay now or pay later situations. And so it's terrible. It's hard. I really recognize that, and I know many people are suffering. Our fear from the healthcare side is that if we open up too early, we will create larger economic problems and larger burdens on society. We also really feel the need to get open as soon as we can. So this is a struggle. This is a struggle, quite honestly, that we're all facing, and that we don't all have all the answers. So I think that's why we need to keep these conversations alive, and why we need our public health officials to work very hard to check the data, follow the data, so that we can decide when it's safe to open as soon as we can.
Yeah, thank you, doctor. I know it's a really careful balance to try and figure out what is, in the best interest of all of the different parts of elements of society. And just as when you talked about food and food security, a little bit of data on what's going on there from a federal response perspective. We added about $500 million to WIC appropriations under the Family First Act, which was a 40% increase in SNAP benefits through the emergency allotments allocated to families. And that amounted to about $240 extra per month per family of five and so just a little bit of background on that too. We have been also doing some work with the USDA, making sure that they're buying product that is available unexpectedly from farmers, et cetera, and making sure that we're heading that or redirecting that to food banks as well. And I have spent a lot of time talking to our farming communities, mushroom dairy and otherwise in our communities, about the impact on that they're experiencing. And of course, we've all read in the news that it's pretty significant and pretty extreme. The next question is for you, doctor, and it is, how many tests are available in Pennsylvania? We know only testing and contact tracing can ease the spread.
Yeah, it's a great question. And to make sure everyone understands the underlying issues with that question, we need to test people for this virus. And it's not just a matter of identifying for treatment, but one of the major tools of public health is to find who has the virus, understand who they interact with, so we can do appropriate messaging, quarantining, and so forth. It's one of the most effective tools that's been used by other countries to really stem the tide of this pandemic. As many of you know, in the US, testing has lagged. It's been insufficient. Despite what some in national leadership say, we're still behind the curve. Tests have not been delivered. And this is to a certain extent a supply chain problem. We want to do the tests. Our laboratories are available, but we don't have the reagents, the chemicals needed to do tests in adequate amounts. So to a certain extent, that's been the struggle, a supply chain struggle. In Pennsylvania, tests have ramped up remarkably. I've seen a huge increase in our ability to test at University of Pennsylvania. Other colleagues at other Pennsylvania hospitals have also reported big increases. So that's good news. I still think they're insufficient, honestly. We're working on that. It's getting better, though, every day. We're testing more people. And it's important to understand that that is one of the key things. So if we're going to keep the pressure on federal healthcare authorities for anything, I think it would be both for clear, consistent messaging and the truth, because we all want the truth, but also testing. We really, really need to ramp up testing. And experts in the testing realm tell me that we really need to be able to do millions of tests per day. We're currently in the United States at several 100,000 tests per day, is sort of the ballpark estimate I'm getting. So we probably still have to quadruple or even quintuple the amount of tests we do per day so that we can really adequately understand what's going on. Because untested individuals are people who may be spreading the virus. So in summary, in Pennsylvania, we're still behind. We're getting there. We're making progress, but we need more testing. And I think that's an area where public pressure can be really helpful to say, where are the tests? I need tests. Where are the tests?
Yeah, and I agree with that. And thank you for that question. There's a similar question apparently in the queue that asks about what's happening on the state and federal level with regard to initiating a coordinated plan for testing, contact tracing, and quarantine. I think this is critical. As the doctor mentioned, I think that you all out in the audience have a real opportunity to express your displeasure and voice your concerns. From my perspective, am working aggressively to make sure that we have a national testing strategy and that we also have the workforce that's necessary to do that, because there are arguably hundreds of thousands of people that we will need, if not more, to be able to execute on whatever sort of tracing and contact testing that we need to be doing to be able to make sure that we don't have a recurrence. And so, as I mentioned in my remarks, some of the work I'm doing legislatively is to try and encourage a national service corps of people who can be helpful to our already existing medical corps to make sure that we can do those tests aggressively. But that can't happen, to the doctor's point, unless we have a robust supply chain of these tests, and that it's more complicated than just having a test. You need the reagents, you need the swabs, you need, of course, the staff. And so that's an enormous supply chain challenge that we have seemed not capable to rise to quite yet. And so I've been aggressively advocating for a national and centralized strategy there, where, as an example, we invoke the Defense Production Act to make sure that we do have the equipment and the raw materials that we need to be able to do the tests that we have. And so there's a lot that we need to do to stand up a robust national testing strategy. It is, I think, key to making sure that we can safely reopen our economy and ourselves to this pandemic. And thank you both for your questions. It says, next question is from Betsy, and I think that this is probably for me. It says, I have a 20-year-old daughter, and I think it's very unfair and inequitable that she is ineligible for the stimulus rebate. I'm sorry, my screen just flashed your question away from me, so hold on. She is excluded from my $500 payment for children because she's over 17, and she's also excluded from $1,200 payment as a taxpayer because she's a dependent on my taxes. It seems very unfair to exclude this group of citizens, especially college students who have been displaced and who are not receiving their full college education. Please fix this situation. And I very much appreciate your concern, Betsy. I have 3 girls in their 20s as well, and I recognize that this is an issue. In fact, pretty quickly early on, we recognized that there was a gap in coverage and a gap in help here. And so I'm a co-sponsor of a piece of legislation that's called the Dependent Children Count Act. So it's a very appropriately named act, HR 6420. The legislation builds on the Coronavirus Aid, Relief, and Economic Security Act, or the CARES Act, and it is reflective and supportive of the needs of so many families like yours that you've recognized. The legislation expands the definition of dependent for the Recovery Rebate Act for individuals to include children younger than 19, students 24 and younger, and no age limit for those who are disabled. And as an example, I have a nephew who is an adult but autistic and dependent on my brother. And so there are definitely gaps we recognize. I, as mentioned, am a co-sponsor of this piece of legislation. Betsy, I would advocate for you to pick up the phone and call your, if I'm your representative, I hear you. Also call all the other representatives that you can, inclusive of your senators, to let them know that this is an important gap that needs filling. And I would encourage other people who are on the line as well to do the same if this is an important issue for you. The next question is from DEEP, or DEEP, I guess. We seem to have about 43,000 reported COVID cases in Pennsylvania with 2,000 deaths. Why are the numbers in Pennsylvania so much lower than in New York? Are we underreporting the results, or are we doing something different here than in New York? Dr. Abella, can you help us to maybe understand that?
Yeah. So actually, reframe the question for me a little bit. I'm looking at it here. I want to make sure I understand what's being asked. So this is we're looking at the question of Pennsylvania versus New York. Is that the issue?
Yes, yeah. Exactly. Is there something different between the two states?
Yeah. It's a challenging question. Certainly, it's true that New York has seen a much greater surge, many more cases than Pennsylvania, and a really tragic mortality from this pandemic. And so, is it the social contact issue? One thing I have to say, Pennsylvania was good about getting out early, and it really complements state leadership on getting out early about social distancing and clear messaging. So that may have helped. It may just be a population density issue. There are many who believe that New York City and its environs, where a lot of the activity of the virus has been, it's just really crowded, and public transportation is a big part of that. And so that's a real challenge. Whereas Pennsylvania, perhaps less so. A lot of this is sort of outside my knowledge base as an emergency doc. This has to do with public transportation and societal structures. But honestly, we don't really completely know. I mean, that's the most honest answer. But it is true that New York has had a much worse time. And one interesting effect for us is we've actually had many patients show up in southeastern Pennsylvania from New York and New Jersey seeking care because the hospitals there have been overwhelmed. Now that seems to have faded. New York's epidemic seems to have somewhat softened, but it's been really tragic. For those following the news, I think it bears mentioning that one of our sort of comrades, an emergency doc in New York, took her own life, and this was big news recently. I knew her, many others knew her, and the issue there is it was just so overwhelming in New York. And I think it really left a challenging and indelible mark on many. So I really, my heart goes out to her family. That was a very, very awful thing to hear. The Pennsylvania hospitals have not been overwhelmed. We have been very busy, but we've been able to keep pace. So that's the good news. So I think the other really important message to sort of come off of that question was, if you need care in hospitals in Pennsylvania, we can take care of you. And we have all established systems to corral and sort of keep separate COVID patients. So we have sort of clean areas, less clean areas. So we have systems in place. This is important because what we're now worrying about, and we're seeing this, is patients are not coming to emergency rooms with chest pain, with stroke symptoms, because they're worried about getting COVID. And it's important to know we're here for you. The emergency medical system wants to serve patients who need us. And so know that we have many precautions in place to keep people safe and keep people from getting COVID. What we don't want is people staying home with their severe crushing chest pain when they're 55 years old, or with their slurred speech. They should be seeking medical attention. And we have the capacity in Pennsylvania to take care of you.
I appreciate that conversation, doctor, and I'm particularly struck by the fact that you knew that doctor up in New York. I read that article about her death, and it is tragic. And I am concerned about our frontliners, our first responders. All of these people are heroes in this fight, and I do worry about the mental health impact that this will have on you all and on our society at large. And so I think that's another round of response that I feel responsible to you guys, is to make sure that I'm thinking about that as well, because there will be long-term implications. I mentioned that I'm a veteran, and to me, this is a war, and we need to make sure that we're treating the folks who are on the front line as with the hero status that they deserve. And so I'll be making sure to work on that too. Also, I don't know, I did read an article in the New York Times recently that was about the speculation about, dense populations who are more close to one another, and the impact of the virus on those more dense populations, meaning New York. And it contrasted, as an example, Philadelphia versus Harrisburg, I believe is what the contrasting was. So we are learning pretty rapidly kind of what we can about this disease. And I also know that we were fortunate in many ways, because we were a couple weeks behind some of those places like New York, like Washington State. And I think we were able to kind of have a cautionary tale in watching that unfold there, and be able to respond aggressively as a consequence. So thank you for your comments there. The next question is from Margaret. How can Congress get POTUS to use an executive order to get masks and testing supplies in the hands of healthcare workers? So we talked a little bit about this, Margaret, and it definitely is something that I have been concerned about too. We have a supply chain issue, as you've seen. We have a dependence on manufacturing that is not necessarily coming from our nation. I and many other people have been aggressively advocating for a more aggressive use of the Defense Production Act, which is basically the president's ability to say that we need to pivot our manufacturing capabilities and our competencies to the things that we need. And masks is an example of one of those things that we need. This response has very much lagged, and I have been in the last several weeks pretty disappointed with that. But I think you are starting to see that change through congressional pressure, through the pressure of our communities and our and people like you. I think we're starting to see a response on the part of the administration to being more aggressive about this. One of these things that I'm trying to do as a result of this pandemic is to start within my office something that I'm calling the Never Again agenda. I very much want to make sure that we never see ourselves in this position again. And even if some people believe that this is a once in 100-year pandemic, I am not of the opinion that this is that. I believe that as our climate warms, I believe that as we are more and more proximate to one another, that this will be diseases that we don't expect, novel diseases, will be popping up with more regularity. And I want to make sure that we're addressing this issue like supply chain issues, this issue like manufacturing in our country of things like protective equipment, so that we are not caught flat-footed again. So I've been working very closely with FEMA and with Pennsylvania Emergency Management on these issues to make sure that we're not caught again in this position. Doctor, do you have any comments on that, on the masks or on PPE or on how your experience with those things?
Yeah, so it still remains a challenge, honestly. So many hospitals have insufficient PPE. And for those who don't know, the term PPE, personal protective equipment, this involves masks like the N95 I have at my neck right now, eyewear, caps, other related things. Relatively inexpensive things, honestly, but it's been very difficult. And for reasons that are unclear to me, there have been sort of diversions of supplies. There's been challenges for hospitals to obtain these. So there's been a lot of grassroots efforts, actually, to get hospitals and healthcare providers the supplies they need. It still remains a major problem. And I think better federal action through things like the Defense Production Act seem to me, as a healthcare worker, not as a legislator, this is the time. If not now, why not? I mean, this is the time to use these things. We have a tremendous capacity, will, and manufacturing know-how in this country. We need to coordinate it and put it to work for us. It's an all hands on deck sort of moment. The countries that have done very well with this pandemic have really prioritized protecting frontline workers and healthcare workers. In the United States, healthcare workers have been a disproportionate number of the cases and a disproportionate number of the fatalities from this pandemic. And the reason why is we're exposed constantly, and we're being exposed to people who are very sick and are shedding. So it's a really important thing to understand that we need to be kept able to work. We want to work. It's not a selfish thing. It's a thing so that we can keep active and keep protecting everyone else. And so it still remains a big problem. Having enough ventilators has also been a problem. People who are very sick from COVID disease require intubation and ventilation, being put on breathing machines. And they often remain on these breathing machines for a very long period of time, often a week or 2 weeks. And so ventilator supply has also been a big issue. So yeah, I think if Congress and others at the national level can work to coordinate, I think that would really be important.
Thank you. Thank you for that. We have another question that I think is for you, Doctor, as well, which is from Cheryl. Quest Diagnostic is offering a COVID test for $120 to determine if you have had COVID or if you have the antibodies. Is it worthwhile?
Yeah, that's a great question. So to explain to everyone, there's tests for the virus itself, and then there's tests in your blood for the antibodies against the virus. And the theory would be that if you've had the virus, you would have antibodies in your blood that would have helped you shed yourself of the virus and get well. And so with many other viruses, if you have the antibodies, that means you had it and you're now immune. Uh, Honestly, the value of those tests is murky because we don't yet know whether having antibodies truly means you will not get the virus again. For example, you may know that every year you need a different flu shot. By getting the flu shot, your body makes immunity against the flu, but you need a new one for the next year. That's because the flu virus changes and the immunity is not perfect. The same may be the case for this coronavirus. It's got a high mutation rate, things change. So honestly, I think the antibody tests are very useful from a research perspective. And I think if one can afford it, of course, it's good to know whether you've had the virus or not. On the other hand, the public health value of antibody testing is very much in question still. And our fear as healthcare providers is that people who get antibody testing will say, I'm antibody positive, I'm now immune, and I can do whatever I want. That is not clear. And we fear that it may lead to incorrect assumptions about safety.
Yeah, and I would absolutely kind of reiterate that we need to be smart consumers. And I think by asking this question, it's a really good and smart consumer asking a good question. You should definitely be looking around to understand what tests have been approved by the FDA and making sure that you understand any efficacy of any sort of thing that you sign yourself up for to be able to make good decisions for your health. I want to emphasize the doctor's statement that I don't think we really know yet if this gives you any sort of clean bill of health. Nor if you, for whatever reason, do take this test and get back positive results, meaning that you have had the COVID, that necessarily means you should change your behavior in any way. You still should be social distancing. You still should wear a mask. You still should be regularly washing your hands. And so I think that it's still, up in the air what we will gain from these tests individually. And I think it's an excellent question, though. Thanks for your question. It says we have. Okay, let's see if we have any more questions. We have time for one last question. It says, if we didn't get to your question, please make sure to reach out to us so we can provide you an answer. Our last question comes from Nithya, which is, what can we do? I think that this is a really good question. What can we do? Here we are, and we're all in this together. And this is where I would emphasize that this is our opportunity to really genuinely be our best selves. This is a time for all of us to recognize that we're part of a very intricate ecosystem and a web of people that all depend on us to do the right thing for each other and by each other. And so I think the best thing that we can do is to be kind to each other and to ourselves, and to make sure that we're taking care of ourselves individually. And that means making sure that you're physically healthy and doing the right things, but also that you're mentally healthy and tending to your brain as well, because this is hard. I'm not going to lie. I know that a lot of people are struggling with this, as we've talked about, and we should recognize that this is an unusual time that requires us to be our best selves. Doctor, would you have anything to add in terms of what can we do?
Yeah, and it is a very important question. I think one thing I draw inspiration from as an American is that our country's been through tremendous challenges in the past, before our time, but certainly we've all learned the history, the Civil War, the Great Depression, World Wars, and the American spirit. I believe in it, and I think we can bounce back from this too. I think to do so, though, I agree very much with Representative Houlihan. I think we have to stay close to our families and social networks. And notice I say stay close. I don't mean physically, but stay close emotionally, phone calls, checking in on people. It's important to know that most people who get this virus fully recover. That's very important to know. Most people who get this will make full recovery. Now, that isn't to minimize that this is a difficult situation and that people die, and it's an enormous tragedy that we have to deal with. And I think, by the way, we have to recognize that too. I think the national leadership and all of us need to really put a name to this, that this is a tragedy and families are being broken. and hearts are being broken. I have to say it. I feel that national leadership has not really paid enough attention to the emotional impact of this, and we have to put a name to that. That's part of the healing process. So we have to recognize that, but we also have to remember that most people do recover, and that if we go to good information sources and only share good information sources with others, that is a very important thing we can do. I also think there are a number of organizations that, if you're able to support financially, are really helpful out there to build support to help healthcare workers, to help frontline workers. And I agree very much with Representative Houlihan. We have to be respectful of each other and kind to each other. Every time you go to the grocery, that grocery worker, wow, they are putting themselves at enormous risk. And we have to recognize that. We have to thank them. If you have extra masks, offer them masks. These sort of actions to show that we're a society and we can get through this, I think, are much more important than perhaps we recognize.
I absolutely agree. The doctor was also mentioning, you can support financially organizations if you're able to. You also can volunteer if you're able to, if you're healthy and you feel comfortable doing it. There are many opportunities to volunteer in our communities, whether it's at food banks. My daughter and I go once a week for a couple hours down the block and volunteer, or giving blood. That is definitely still a pressing need if you are healthy and feel comfortable doing that. That's another way that you can be of assistance. Helping in your community. Last evening there was, I think, Takeout Tuesdays in our community, and so we bought from one of our local favorite restaurants. There are many things you can do to feel empowered and happy and healthy during this, but I really appreciate the question. Doctor, I think that concludes our conversation today. I remain enormously grateful to you for the time that you allow us to get an insight into what it's like to be on the front line. I'm going to let you go and go save lives, and I'm going to wrap things up here. Thank you so much for participating in our town hall, and I look forward to future conversations with you.
Well, thank you for your leadership, and I think these conversations are so important, so thank you for organizing them.
Thank you, sir. Bye-bye. And with that, I think what I'll do, if it's okay with folks, is wrap up a little bit and then let everybody go. A reminder that, let us know if you have any questions. You can email us at those websites that I mentioned. Thank you, everyone, for joining us in this conversation. And I want to thank the doctor again for his time and his service to our community during this very difficult crisis. Across our offices in Reading and Westchester and DC, my colleagues and I are working to protect our communities and to make sure that all of us have clear and consistent guidance to make smart decisions about your health. And as you've heard today, it's very, very important that we take care of each other and that we take care of ourselves, as I mentioned, both physically and mentally. This is a very, very abrupt change in many of our daily routines. And please do feel free to reach out for help if you need it, because we are all in this together. This is not about any one individual, but it is rather about our community as a whole. And only through our collective effort on a united front can we hope to mitigate the spread of this virus and to protect our most vulnerable, including, as the doctor mentioned, our healthcare workers and our first responders. A reminder of some of the things that we can all be doing on the individual level. As we mentioned, and as the doctor mentioned, washing your hands with soap and water as often as possible for at least 20 seconds, especially if you've been in a public place or after blowing your nose or coughing or sneezing. Please avoid touching your eyes, your nose, and your mouth with unwashed hands. As we talked about, practice social distancing by keeping about 6 feet distance between you and other people whenever possible. And as ordered by our governor, only go out for essential purposes, for food or prescriptions, etc. And of course, stay home if you're sick. I want everyone on this line to know that our office is available to you to connect with our resources. And I also encourage you again to check out those resources at our website. Our website, again, is Houlihan. It's spelled HOULAHAN.house.gov. And there on the banners in particular, the top banner, you'll find a lot of clicks and link throughs to special help for small businesses or unemployment compensation or otherwise. You'll find updates there on the coronavirus and resources, including State Department travel warnings and CDC contact information. Thank you, everyone. As always, it's a pleasure to serve with you and for you. I hope that you and yours stay well and are safe. And with that, I will say goodbye and thank you.